Assalamualaikum and good day. My name is Dr. Mokhzani from the Department of Surgery, and I'm here today to demonstrate on how to perform digital rectal examination. The indications for performing a digital rectal examination will include any gastrointestinal symptoms such as alteration in bowel habit, alteration in stool consistency, any mucus discharge per rectum, any bleeding per rectum, as well as any anal symptoms such as anal pain or pruritus per anus. The equipment that is important for this procedure will be disposable gloves, some type of lubricating gel, as well as a type of napkin or tissue to help the patient wipe themselves after the procedure. Before conducting the examination, it is important to inform the patient that you are going to examine their backside, that it will be an uncomfortable procedure, but also important to emphasize that it will not be painful. The position of the patient is in the left lateral decubitus position as being demonstrated here. The hip should be flexed at 90 degrees. The knee should also be flexed at about 90 degrees as well. The patient should be facing away from you, and it is best to have the patient as close to the edge of the examination table as possible for best ergonomic while you are doing the procedure. Upon application of your examination gloves, you start the examination by doing inspection. Using your left hand, lift up the upper part of the buttock to expose the relevant area. It is now important to appreciate the surface anatomy relevant to this examination. First of all, you have the anus opening, and the area around the anus opening is called the perianal area. Anterior to that is the perineum. In the male, the perineum is bordered by the anus posteriorly as well as the scrotum anteriorly. In the female, the perineum is bordered by the anus posteriorly and the labia anteriorly. So these are the relevant surface anatomy. You begin the examination with inspection. Look for evidence of any scratch marks or excoriations or ulcers in the perianal area, perineum, as well as the surrounding area. You also want to look for evidence of mass. Common masses that you can encounter in the perianal area will be things such as skin tag, external hemorrhoid, as well as prolapsed internal hemorrhoid. You may also encounter pathologies such as condylomata or papilloma of the anal area. Another common thing that you need to inspect is the presence of abnormal opening. This normally present in the perianal area. This may indicate the presence of anal fistula or anal sinus. Last but not least, it is also important to recognize and look for evidence of fissure, perianal fissure or ulcer. The significance of which is patient will have significant amount of pain if you proceed with digital rectal examination, and it is best not to proceed with digital examination if you have evidence of fissure present. Once that is done, it is time to examine further, and you begin by applying the lubricating gel at the tip of the index finger of your right hand. In the same manner in which we have lifted up the upper part of the buttock with your left hand, inform the patient that you are going to insert your finger, as you perform the examination, apply gentle pressure using the top of your index finger at the center of the anus, along the axis of the perineum, and apply backward pressure in this way, and feel for the tone of the anal sphincter. As you apply the gentle pressure, it is important to inform the patient to relax their sphincter, and as you feel the sphincter relaxes, gently advance your finger inside and assess in a 360-degree rotatory movement. So you cover the circumferential of the rectum, as well as to assess the surface of the prostate anteriorly. Once you are done, withdraw and have a look at the finger. Look for the consistency and color of the feces, as well as presence or absence of blood or mucus. Always maintain patient modesty, and help the patient to clean himself or herself up afterwards with some type of tissue. Now, it is important that you perform the digital rectal examination in the quickest manner possible, because it can understandably cause discomfort to the patient if you were to do it, over a prolonged period of time. And which is why I am now going to describe to you what are the significant findings that you should be aware of when you're doing the examination. The first thing that you need to assess when you perform the examination per se is to look for any evidence of rectal mass. It is important to be able to differentiate between hard stool versus rectal mass. Hard stool or stool is, when it is present, is indentable with your finger, whereas a rectal mass of any pathology will not be indentable. Once you have been able to differentiate between stool and rectal mass, the next step is to be able to differentiate whether the rectal mass is intraluminal or extraluminal in origin. Intraluminal rectal mass will have irregular surface, whereas a mass in the rectum, which is due to external compression, will have a smooth and regular surface, because the mucosa integrity is preserved in cases of extraluminal mass causing compression to the rectum. It is also important to be able to document how far is the mass from the anal verge, as measured by the tip of the finger when you do your examination. The other important component that you want to assess when doing digital rectal examination is assessment of the prostate in male. It is located anterior to the rectum, and the prostate gland is being described as having a smooth, firm and rubbery surfaces, and it measures about 2 to 3 centimeters from side to side. You are able to feel the top of the prostate in a normal size prostate, and you also are able to appreciate the median sulcus of the normal prostate. Common pathologies of the prostate gland include enlarged prostate gland in situations of BPH, benign prostatic hyperplasia, in which the prostate gland is enlarged but maintains its smooth surface and firm and rubbery texture. Another common pathology of the prostate you may encounter will be presence of prostate carcinoma, in which case you will be able to appreciate presence of hard nodules over the surface of the prostate gland. Thank you very much.